Our topic is addiction. Hello teacher, my name is Fátima Sánchez. What is addiction? Addiction is a chronic and recurring disease of the brain. It is based on the sure for life through the consumption or use of substances or other similar behavior. The development of the behavior limits for the addicted person the inability to control, difficulty to obtain this desire to consume, decreased recovery of the problem derived from addiction, and interpersonal relativity as well as a dysfunctional emotional response. This creates problems in the life of the addicted person, diminishes her quality of life. Apart from addiction to toxic substances, alcoholism, and drug dependencies, here are where multiple addiction too.
Prognosis of the disease. Addiction can lead to serious problems for the physical and mental health of the patient. It is important to detect them in an early stage to achieve an effective diagnosis and treatment. For that reason, the collaboration of friends and family is very important, both in the detection as in the treatment and follow-up. Frequently, addicted people have health problems derived from their addiction, especially in the case of toxic substances. This can be heart, lung, cancer, or mental health conditions. Also, addiction to sex or drug can increase the risk of serious infection, such as HIV or hepatitis C. In addiction, the coexistence of mental illnesses is also common. Some disorders, such as anxiety, schizophrenia, or depression, can result from drug use or become worse as a result. Finally, addiction can end up affecting and causing harm to other people, especially in cases of pregnancy, but also due to stress or anxiety.
Symptoms of addiction. The symptoms of the pathology vary according to the addiction satisfied the patient and the individual personality characteristics. However, there are several common signs in small cases of addiction: loss of control, wide episodes of compulsive usage that affect their personal general life, signs mood, irritability, impairs quality of life, denial of self, deception, anxiety, obsession, persistence of especially insomnia, addiction symptoms must be especially in psychiatry. with specialists that addiction may lead, especially in psychiatry. Symptoms with
medical tests for addictions. In the first place, they are self-diagnostic tests which can be answered by people with addiction substance or relatives to make a fair assessment of the severity of the addiction problem. In many cases, the closest people, such as friends and family, are the ones who dictate the fair behaviors or physical or psychological signs of addictions. Specialists follow various diagnostic criteria to deter possible addictions. Drug addictions these tests are a useful tool in the detection, diagnosis, and monitoring and treatment. Clinical history. It is important to know the family history in order to establish a complete clinical picture. Physical exam, several key signs that a specialist can identify in a complete medical physical exam. Psychopathological evaluation, medical test for addictions.
Hi, my name is Fátima Sánchez, and I am going to comment on what are the causes of addictions. Alright, the causes of addictions are multiple interact in the complex way that leads to addictive disorders. The causes are different for each patient. For what should be individually should each case in carried out are studied for their personal history and family in order to make the most appropriate diagnosis. Personality factors play a fundamental role in the development of an addiction. There are some specific characteristics, such as difficult meaning ones, want feelings or low tolerance for frustrations that facilitate activity disorder. Treatment for addiction. There are multiple methods to treat different addictions that depend on the individual situation of each patient. Among them, we find individual psychiatry, therapy, individual and or group psychotherapy, self-help group and family therapy, guidance and therapy section for family and friends. Once the parent is able to quit that addiction, he will continue a recovery process to regain control of his life and return to brain production. In the case of suffering in the relapse, you should go to the specialist to restart the training, modify if or try a different one.
Types of addiction. There are substance and behavior addiction that all share the same evolutionary process and symptomatology. The most common addiction is that related to drug abuse, but the consequences can have an impact similar to when behaviors such as internet use, such as love, food, physical exercise, or abuse, shopping, or any other compulsive behavior that becomes an obsession and gets the affected person's life out of control. Two basic types of addiction are different: certain addiction and behavior addictions.
Drugs mainly affect three areas of the brain. The brain stem, which is charged of all the function that the body needs to live: breathing, blood circulation, and the digestion of food. It also connects the brain with the spinal cord, which drums the lens to the back and moves the limbs and muscles. In addiction, it notifies the brain of what is happening in the body. The limbic system, which connects a series of brain structures that control our emotional response, shows the feeling of pleasures when we eat chocolate or kiss a person we love. Pleasant sensation motivate us to repeat the behavior, which can be good because things like food and love are fundamental to life. His cerebral cortex, which is the outer part of the brain shaped like a mushroom, the great mother. In human, it is so large that it represents approximately 3/4 of the entire brain. It is divided into four areas called love that control specific functions. Some areas process information for the sense and allows to see, feel, hear, and perceive flavors. The front part of the cortex, known as the frontal cortex, is the thinking part, directs our ability to think, plan, solve play problems, and make decisions.
Conclusion. Addiction is a path of thorn that the addict walks barefoot. It doesn't matter how much you hide the pain, and although it is not reflected in his countenance and immense emptiness within, he keeps him submerged in intense agony. No matter how much he says that he does not hurt, that he does not suffer, he knows the immensity of their life. Only with the help of something greater than ourselves and the courage to face ourselves do we leave that thorny path behind.